Hi, my name's Elizabeth Cannon, and I'm the Executive Director at the Lowell Association for the Blind. I'm here today with Jim Klocke, the CEO of the Massachusetts Nonprofit Network. Welcome, Jim.
Thanks for having me, Elizabeth.
I'm so glad you could come. We're going to have some discussion about nonprofits and the nonprofit work that's done both on the statewide level and here in the greater Lowell area. So welcome, Jim. Why don't you tell us a little bit about the work and what MMNN, the Mass Nonprofit Network, is and what it is that you do.
Sure. So MMNN is the state's nonprofit association. We represent and serve all types of nonprofits in Massachusetts. We help them on public issues. We help them with services and networking and programming. And we try to tell the message, spread the word about all the great work that nonprofits do across Massachusetts. Our headline about the nonprofit sector is that it is one of the biggest, most important, and best sectors in Massachusetts. And we'll talk about each of those in a brief way. First of all, the nonprofit sector is huge. Nonprofits in Massachusetts employ over 550,000 people across the Commonwealth. That's almost 20% of our workforce. And a good way to think about it is that that is more jobs. There are more jobs in the Massachusetts nonprofit sector than there are in the manufacturing sector and the financial services sector combined. So the nonprofit sector is big. The nonprofit sector is important. Nonprofits do amazing, creative, vital work in all kinds of ways across Massachusetts. Hospitals are nonprofits. Educational providers are nonprofits. Community development corporations are nonprofits. Human services organizations are nonprofits. The common thread they all share is that they're all working for the public interest. They exist to serve people. In fact, most people don't realize this. If someone starts a nonprofit, you actually have to certify, legally pledge, that you're going to be faithful to your public mission, that your public mission and the people you serve comes first. So all your work has to be for the people you serve. All your resources have to be dedicated to the people you serve. That's a great commitment. And what that means, combined with the size of the sector, is that there are an awful lot of people across the state doing amazing, inspirational work every day for the sole purpose of helping their neighbors and promoting the common good. That's why we say it's the best sector in Massachusetts. People often don't think of it as a big innovator, but in fact, the nonprofit sector is a fountain of innovation. Many of the biggest, most important social structures we have in Massachusetts, many of the most important government services and programs began as a new idea in a nonprofit. So nonprofits in some cases are delivering services that we all know about, needed every day. In other cases, nonprofits are being very creative and innovative. New ways to help kids with after-school programs, new ways to serve seniors who are having trouble getting around or who might be confined to their homes. That kind of innovation is also a really dynamic part of the sector. We like to think Massachusetts is the hub of innovation, and it is, and we want people to know that nonprofit innovation is happening every day across the state to the benefit of everybody across the state.
And as you know, nonprofits come in all sizes.
They do.
I know from working in a small nonprofit, but you see nonprofits of all sizes and shapes across Massachusetts.
We do. You know, if you look up the numbers, there are over 30,000 nonprofit organizations in Massachusetts, and that's a big number. Frankly, that's a good thing. That's a sign of innovation and creativity. But if you look at the how people are distributed, as you say, a lot of small organizations, a lot of medium organizations, a smaller number of big organizations. The jobs in nonprofits are across the board. These jobs are not just all in big institutions. In fact, more than half the nonprofit jobs are in nonprofits that are not hospitals or universities. What that means is that most nonprofits, community-based, community-oriented. One of the pieces of advice we give nonprofits, whether you're small or medium or large, is not only to engage at the community level, many people do that, engage with your local public leaders and officials. Sometimes you have to do that if you're a partner with government, but even if you don't, it's good to do it. It's good that they know about the work that you do. It's good to have those relationships so that if the time comes when there's a question you have, when there's an issue, when there's a need, they already know the good work that you do. So plugging yourself into the community, connecting yourself with peers and with leaders is important. That's one of the things we help nonprofits with, and we see the nonprofits that do that, small, medium, and large, it helps. It has a really great ripple effect over time.
I think people are surprised when they see nonprofits do work together. We are a member of the Nonprofit Alliance here in Lowell, and we have 30 or 40 nonprofits that are members of our organization, and I know your organization has even more members.
We are statewide, and so we have almost 900 members, which is great. And I will share the Lowell experience we have here. We work with nonprofits across the state, nonprofit networks across the state. Lowell has one of the best nonprofit networks in Massachusetts. When we come to Lowell for events, partner with you, partner with colleagues, there's a really great connected community of nonprofit leaders here. And frankly, I think that's the kind of model that we would do well to replicate across Massachusetts.
I know when, years ago when we started, we've evolved over the years. One of our members was critical in the forming of the MMNN organization, and there was a lot of time and thought put onto what we did versus what would work on a statewide level. So it's kind of exciting that you're still in place, and NPA, as we call it here in Lowell, is still a factor in the greater Lowell area. But I think nonprofits do work together a lot, and that is a surprise.
They do, and it's interesting on the issues front, State House advocacy. We do a lot of work with nonprofit groups in different communities. We also do work with statewide associations. Again, the more you're connected to each other, you learn from each other, you share best practices, and you can present a united voice at the State House, a united voice at the local level. We even do some issues in Washington. The united voice is really powerful.
Thanks for sharing that, Jim. And welcome back. I'm here again with Jim Klocke from the Mass Nonprofit Network, and we're going to have a little bit of time to talk about charitable giving.
Very important.
I know you have a fountain of information about what's happening with charitable giving these days.
We want people to know, first of all, charitable giving is really important to nonprofits. And so the first thing we want to say is thank you to everybody who gives to nonprofits. And the second thing we want to say is keep giving. Mm-hmm. This picture has changed in the last few years. We know from talking to our members, we survey our members, 90% of all the nonprofits that are members of MMNN rely on individual donations. You may write a small check to a nonprofit, but don't think that your donation isn't important. It is. It is important to almost every nonprofit in Lowell and in Massachusetts. So we're always trying to think about ways to help promote giving. What changed recently is that a couple of years ago, the federal government did a big tax bill. They made a lot of changes. They lowered people's taxes, and that was fine. But they also made some other changes which threatened to hurt charitable giving. In particular, one of the things they did was to double the standard deduction.
Right.
Money in people's pockets, good thing. The only problem is that means that a lot of people will no longer get a federal tax break for their charitable giving because they're not itemizing their deductions anymore. The estimates are that 2/3 of all the people across the country who have had that federal deduction will not have it anymore. So we want to encourage people to keep giving. There's been some evidence that in 2018, individual giving across the country declined a little bit. We're worried about the 2019 numbers. We think some people realized this in April of 2019 when they sat down to do their taxes, and all of a sudden they learned they didn't get the deduction anymore. So what has MMNN been doing? We've been trying to help nonprofits improve their fundraising strategies, their communications, their outreach. All of that makes a big difference. There's a little bit of good news here. Massachusetts has just put in place a state tax deduction for charitable giving. This is something that Massachusetts voters approved 20 years ago. It was on the ballot. It takes a little time. It was on the ballot in 2000. It was approved with a 67% yes vote. It was delayed for a long time. There was a recession at the time, and the lawmakers thought they should delay it, but last December, it came back. What it means is that for donations people make in Massachusetts, in 2021 and beyond, there is a state charitable tax deduction. The other good thing about this, it's available to everybody, not just people who used to itemize on their federal taxes. And so the result of that, this will be a benefit to hundreds of thousands of low and middle income donors across Massachusetts, not just to upper income donors. And we appreciate the support of all donors, upper income donors, lower income donors, but this is a big step forward for Massachusetts. So we have been working on this at MMNN. We're making sure that people in the State House are aware of it. We're educating nonprofits about how to work with it. But the individual giving for so many nonprofits, it's their lifeblood. It's money to keep the lights on and to deliver services. It's also a great way to connect with supporters. Some people want to help by volunteering. Some people want to help by donating. And the more we can help people do that, the better.
Absolutely. And I often think that the small charitable donations are the ones that do keep the lights on in small nonprofits, because oftentimes with grants or things, you're so limited to what you can use that those
Right.
small dollar donations make a big impact for local nonprofits. And there's so many nonprofits that do so much good work that you can
Yeah.
find one that's close to your heart, or somebody in your family that utilizes the services, or the having different folks that volunteer at services. Everybody knows somebody that does that. So we're always grateful. I know as a small nonprofit locally, and actually we've been in Lowell for 100 years. So times change a lot, and the needs change. So we need to. Do you know how this is going to work? They just going to be? You just going to have to write one line item on your check, or have they figured that out yet?
They're in the process
They're
of
in the
figuring that out,
process.
yeah.
So we have
And that
to-
would be, I think, the easiest way to do it. I think there's a good chance it will happen that
Yeah.
way. And as I say, it's going to apply for donations in 2021 and beyond. Most states have something like this. We've actually been behind in Massachusetts in not having it, then in delaying it. But over 40 states have a personal income tax system. And of those states, over 30 have a charitable incentive in place. So this is one where, a lot of states realize the value of it. A lot of states have it. We want to be a leader on this front, so we now have it too.
Great. That's something to look forward to for for our donors.
Yes.
And for folks. Will the state promote that through when it comes around, when it
I
gets
think
fully
so.
implemented?
I think so, and it's interesting, as we've told nonprofits about this, a lot of them say, hey, one of the other nice things about this, I can use this in my fundraising communications. This is a nice way for me to encourage people and to get people's attention and to encourage that giving.
Great. Well, I think that's it for this segment. Let's move on to another topic. Welcome back to Good Works. We're here with Jim from Mass Nonprofit Network. I'm Elizabeth Cannon with Lowell Association for the Blind. And I know you've been working on the census a lot with MMNN. Why don't you tell us a little bit about that?
The census is now here. We've been working for over a year with everybody in Lowell and across the state. The census is very important. The census happens every 10 years. Interestingly enough, it's one of the few government steps that's actually in the U.S. Constitution. The framers of the Constitution thought this was so important that they wrote it right into the Constitution. So this is counting everyone who's in America. It's important because it determines where federal funding goes for all these vital programs. It determines political power, not just how many members of Congress we have in Massachusetts, but it also determines how many members of the State House we have for each community in Massachusetts. We know most people are aware of the census only when it comes along. They think, oh yeah, I'll do that at some point. People are going to start getting information in the mail. People are going to be able to go online, and we encourage everybody to do it. It is quick, it is easy, and it is important.
That's great. I know in thinking about the census, MMNN was made us aware of the changes, having everything online, that we're not going to get that packet in the mail. And for the folks that we work with at Lowell Association for the Blind, this is a very much difficult and
Yes.
different situation. So why don't you tell people what to expect?
So very shortly, the mid-March is when they start mailing out online codes to people. You will get something in the mail, a letter from the Census Bureau that says you can now go online. Here's the code to put in for your household. You can go online and complete the census. You'll get a few more reminders over the next several weeks. And then in the middle of April, then the people who have not yet filled it out online might get a phone call, might get a census taker with identification coming to the door and offering to fill it out. We want people to know that this is a very secure enterprise. The data is protected, the data is secure, and we want nonprofits to know that if they have questions, they can contact us at the Census Bureau. If they want to help people with the census, that we can help them do that too.
And I know we at Lowell Association for the Blind have made a huge effort to reach out to folks that may have difficulties reading the codes that they
Yes.
get in the card, as well as maybe accessing the website, that we're there to help them with that. And
Yeah.
I know across the state there's nonprofits that are coming to, that are there to help folks to do that. Did you say that was coming out again?
So we expect that people will begin getting letters from the census in their mailbox in the middle of March, around March 15th or so. And then there will be more to come. The other point we want to share with people is that the census, you can fill out your census form in multiple languages. The online version available in many languages. There are paper copies. So for folks whose primary language is not English, there are a lot of options, and there are a lot of people, including us, who can help you if you need
There's
it.
a phone-in option also, isn't there?
That's right, yes.
So-
Yes. You can do this.
A wide variety
You
of
can
ways.
fill out the census in a number of ways. You can do it on your phone, you can do it on your computer, you can do it on a tablet. There may be computers available at some community centers where you can fill it out. And again, for people who want to do it on paper, there is a paper option, and those will be sent out in April.
So be looking for your census information.
Coming
in the
right now,
mail.
coming now.
Thanks, Jim.
Thanks, Elizabeth.
And welcome back to Good Works. I'm here with Jim from Mass Nonprofit Network. Why don't you tell us a little bit about all the work that Mass Nonprofit Network, you're a small staff, but you do great things.
We work hard, Elizabeth. Thank you. We try to help nonprofits across Massachusetts thrive and do great work and serve more people and serve everybody they want to. We do this in three main areas. First, we do a lot of work on public issues. We work up at the State House. We work with local officials. We even do a little bit of work in Washington. So if there are public issues that any nonprofit is interested in, our website has resources. Our website is massnonprofitnet.org, and we have dedicated staff who can help people with issues large or small. The second thing we do is we try to provide concrete programs and services that help nonprofits in their day-to-day operations. We run a lot of networking events. We offer discounted access to special services, including online grant funding information. You can get it at a steeply discounted price through us. If you want to track everything they do at the State House, we have a service that you can get from a discount for us as well. And on the events front, we have a lot of events throughout the year. They're all on our website, but the two big events that we do a big awards event in June at the State House every year to celebrate excellent work being done by nonprofits. We give out Nonprofit Excellence Awards. We just had nominations. We got over 150 nominations. Wow. So now our judges are going to have to weed through those and pick the winners. We also do an all-day statewide conference of nonprofits every October. This year we're going to be at the DCU Center in Worcester, a great venue, big venue. It's a day of events, speakers, workshops, networking, exhibitors, sponsors, services, kind of brings everybody together in one place for a really great day that's coming this fall. So we always look for ways to help people in practical ways, services, networking, events, public policy, and then the third thing we do is public communications and public messaging. We think the story of the nonprofit sector can't be told often enough. This is a big, important sector. We think it's the best sector in Massachusetts, and we want more people to know about it, and we want to build support for all the great work that nonprofits do every day.
I agree. What's some of the awards that you give out at the awards day?
Well, so we give out an award for innovation. We give out an award for advocacy. We recognize an outstanding up-and-coming young professional. That's one of the hardest to choose because there are so many really great people you have to choose. We also, at our conference in the fall, we honor leaders with a Lifetime Achievement Award. Carol Duncan received that award 2 years ago.
She did.
And we have a great group of alumni who have received that Lifetime Achievement Award that really represent the best leaders of the nonprofit sector in Massachusetts.
And I say the conference is one of those that brings like 600
Yes.
nonprofit professionals together to
Yes.
learn on all kinds of topics that are important to the nonprofit world that we often, as small nonprofits, may not have the access to that wonderful resource or the information from top professionals in their field that you can. There's so much to take away from that event. It's really a great event to be able to attend annually. And it's nice this year. It'll be right in the heart of the state of Massachusetts.
They're excited and we are too. We'll have a great day.
Draw together.
A lot of them say, hey, one of the other nice things about this, I can use this in my fundraising communications. This is a nice way for me to encourage people and to get people's attention and to encourage that giving.
Well, thank you for coming in today, Jim, and
You're
it was a
welcome.
great
Great to
time
be
to have
with
a
you, Elizabeth.
conversation. Topic of the day is the issues with the virus coming
Yes.
around and hitting the nonprofit sector,
Yep.
possibly in the near future. And what are you hearing, Jim, on the state level?
We're hearing a lot, Elizabeth. People are concerned. People are trying to understand what they can do next. And so there's a couple of things we're focusing on. The first is many nonprofits are in touch with a lot of people every day. Sometimes you have a lot of people that you serve. Sometimes you're hosting an event or a meeting, and so people are asking questions. How big does my event have to be before I cancel or postpone it? What we've seen just in the last day or two is a lot more meetings being either canceled or shifted to an online format. We're doing that at MMNN. We have some meetings upcoming which have been shifted to an online format, and that's great. The second thing is, so nonprofits as places that employ people, that have volunteers, what are your best practices for your people? And we have said to people, first of all, keep track of all the relevant information. Secondly, think about expanding your work from home options. We did this in our office. We have a work from home program. We have expanded it so that people can, if people choose, you know what, I'd like to work from home, I'd rather not be kind of commuting and moving around a lot, make it easy for people to do that. We also encourage people to get information and keep track of information through a few resources. The first resource is just your local media. It is a great thing that we have a strong, free, aggressive, independent press and also a strong public health system in Massachusetts and in the country, because the public health experts are the ones who are doing the right things, tracking this, providing the right advice, and the media are the people who are getting it out. So your media outlets, follow it in the media, but also the State Department of Public Health has an excellent website, and the Federal Centers for Disease Control has an excellent website too. If you Google those two places, Google the Massachusetts Department of Public Health, Google the Federal Centers for Disease Control, that's the best objective information you can find. And then we also advise people, stay in touch with colleagues in the community. Sure. This is affecting different communities in different ways. So the right approach for one community might be different from another. As you're in touch with your friends and your colleagues, you're talking to community leaders, that local communication, probably more by phone and email today, a little less in person, is the most powerful step we can take.
Yeah. What kind of economic impact do you think this will have on the nonprofits as we think about it going forward?
Well, we expect there will be impact. We hope not, but we expect there will. And there's at the most broad level probably in two ways. For nonprofits, there will be some revenues that are affected, especially in the case of programs and events and fundraisers. We are heading into the big spring fundraising season, and people are grappling right now with the questions, do we keep our fundraiser the same? Do we make it online? Do we postpone it until the fall? Those are the questions people are grappling with. On the expense side, for organizations, especially in the direct service area, there will be some increased costs, especially organizations that are working with people with medical needs, but also in some cases organizations that are working with, not medical, but working with the elderly. Everybody's thinking about the question about protecting children. And so if you're in a kids program, if you're a daycare provider, if you're an after-school provider, you want to be thinking about those questions. And again, we're here to help. Our website is massnonprofitnet.org, and there are a lot of great resources and great people who are working together on this. We think the best way for people to think about all these steps, whether it's curtailing meetings, not going out, these are positive steps. These are smart things to do, and we know from history and we know from a lot of science that these are the things which are going to help us manage this. So if you get news, oh, some events are canceled, oh, an organization is saying don't come in today, that creates anxiety. But frankly, the way to think about it is this is a smart, proactive thing to do. If we are asked to do these things, it's because this is kind of the right treatment at this time. And doing these things, even though there's inconvenience and challenge associated with, is the best way for us to manage this outbreak and to get to a better place and to get through the outbreak sooner rather than later. So our first reaction, everybody's first reaction might be, oh my goodness, why did they do this? Oh my goodness, what if this happens? But frankly, these are smart steps. These are good steps. And we know from medical history that these are the steps that are going to help us get healthier again.